ご応対しました。リンジン君とバギー君です。それでですね、今福島では、おそらく300人近い
Students have changed Bagi and Dindin. Currently, nearly 300 children in Fukushima are overdiagnosed with thyroid cancer. Then, what do you think should be done about the thyroid examination that is currently being conducted in Fukushima in the future? I think it is important to fully explain to the resident that overdiagnosis is occurring and reduce the psychological burden on the resident. What about the examination itself? I don't think it should be on the scale it is now. What do you think, Baggy? Isn't there a possibility that the small cancer will grow? There are a certain number of cancers that will grow, but nobody knows if it will be 5 years later or 10 years later or so on. Furthermore, the 30-year survival rate for thyroid cancer in children is 99%, and lifetime survival rate is over 95%. The prognosis is almost the same as that of benign tumors. Therefore, the benefits of early diagnosis and early treatment of thyroid cancer in children are not scientifically proven. Well, it's better not to check it because it's just worrying the resident unnecessarily. Why does the examination make them feel more anxious? Wouldn't it be nice to have it examined? Even if the doctor explains that it is a disease that does not need to be treated, they will not be convinced. This story is very important. When the doctor finds a small thyroid cancer, do you think he will tell you that it's fine with the treatment? Oh, he doesn't say so? As a doctor, if he says it's okay, but something goes wrong with it, he will be responsible for the problem. That's why a doctor rarely says that it's okay to be left untreated. Next important discussion. Currently, 300 thyroid cancer patients have been found in Fukushima, an order of magnitude higher. How do you think the residents of Fukushima interpret this fact? I think that the residents are somewhat concerned that it may be the effect of the nuclear plant accident. That's what happens when people don't get enough information. Is it okay to say that you both think it is better to quit the examination? Yes. So let me tell you the present situation. The examination has been running unchanged for over 10 years. Could I ask you the reason why? Is this examination beneficial or harmful for children in Fukushima? It doesn't affect the health condition, right? You may end up having unnecessary surgeries. Okay, if so, it's considered harmful. I have summarized the opinions of some people about this. The Minister of the Environment was questioned by a newspaper reporter. The reporter said, "It seems that the thyroid examination in Fukushima has the harmful effects of overdiagnosis. How will you deal with this?" To this, the minister replied, "It's none of my business." Japanese academic societies explains as follows. Overdiagnosis has already been dealt with, and no serious damage has occurred. Then what do you think the patient who have been diagnosed with thyroid cancer by this examination say? They are thinking that they were lucky to be diagnosed. Actually, that's correct. Some experts say that Fukushima's thyroid examination is causing health problems and should be stopped. To this, one patient said, "It's outrageous to scale back the examination." He condemned in very strong terms. Can you imagine why the so-called authority with power would react in such a tactless manner? At present, there is no big fuss, so they don't think it's necessary to take the risk of stopping it. Well, actually everyone still says that the examination should be continued. What do you think, Baggy? They find it easier not to change. Whenever there's a massive overdiagnosis, the fallacious authorities always pop up. As the students in the first session said, I bet that the leading expert expected that there would be only a few thyroid cancer patients when they planned this examination. However, when the examination was started, hundreds of patients came out, so it turned out to be a miscalculation. What do you do when that happens? If the number is increasing, just keep going without looking back. What do you think, Baggy? It's too late and can't stop anymore. Yes, maybe they think that damage has spread so far, it is not possible to stop now. So, opinions are divided between experts who have an interest in the examination and those who do not. In that case, instead of being based on what is scientifically correct, policies are decided based solely on the idea which is beneficial and which is not. As Lily said earlier, they continue the examination simply because they think there's less commotion if they don't stop it. Then why does the patient think that the examination should be continued? A high percentage of them actually didn't need to be examined, but they were examined and now underwent surgery. Can they accept the idea of overdiagnosis? Which is easier, thinking that getting the examination was the right thing to do, or thinking that it was a mistake? Of course, it's easier to think the decision was right. That's right. Especially when the surgery does not go well and various problems arise, it is very painful to think that it would have been better not to have the examination at that time. That's why we call it paradox. The more harmful the damage is, the more the patient tries to defend the examination. Let's consider the clinical situation. A physician finds cancer, a surgeon operates on it. What do you think these doctors would say to the patient if they found the cancer was likely overdiagnosed? He says simply that you have cancer, as he usually would. That's a good thing for the physician to say. What does the surgeon say? He says he is glad he can operate at an early stage. That's right. He wouldn't say he operated cancer which did not need to be removed. Just says you are lucky. Therefore, in the situation where overdiagnosis is occurring, there is no one, including the patient, to stop the damage. So, if you say that the examination should be stopped because the damage of overdiagnosis is spreading, criticism will be concentrated. Overdiagnosis of Fukushima is also a very good educational material. This video was also taken for educational purposes. There are two reasons. First, what is happening in Fukushima is the world's first case of large-scale overdiagnosis of cancer caused by school checkups. It's rare to have an opportunity to observe something like this in real time. Secondly, It contains the content that everyone should study as a doctor. Let me ask you a question. You became a doctor who examines children. However, when you started the examination, you realized that the examination is causing a severe damage of overdiagnosis. Now, what kind of action will you take? I have no idea. I have no choice but to do as I am told. How about you, Rin? I also have no choice but to do as I am told. But I think it is important to explain overdiagnosis to patient. How do you do that? Would you like to make a proposal to your boss? I will suggest it to my boss. Baggy, do you have any other measures you can think of? I will be the head of the organization. Does that mean that you will change the way you conduct the examination by yourself? That's right. There are some medical professionals who understand the harm of the examination and have tried to let the residents know about the harm and change the way of the examination. What do you think happened to them after that? They were told to quit if they complained. Actually, they were removed from the examination site and then left the workplace. If you were in the same position, would you make such effort? Do you disobey your boss? If I have to leave the workplace for disobeying, I think I have no choice but to comply. Do you mean to close your eye to the current situation for the time being? Yes. How about you, Baggy? Me too. Now I'm irrelevant, so I can say whatever I want, but in reality, I guess can't go against it. In fact, it would be very difficult if you were engaged in the middle of it, because everyone around you is saying that they will promote the examination. However, there were actually such people. That's the salvation in this story. Now the next question. What does this number mean? 872 is the number of thyroid specialists. What do you mean by 2? Number of the people who go against the examination? The number of people who publicly declare the harm of the examination. There are only 2. What are the remaining 870 people doing? Who do you think you would be if you were in the same position? It could be 2 people. Cool, isn't it? So why isn't everyone doing cool things? They might hate losing their current position. Is that what you call entanglement? It would be better to keep quiet than to leave the workplace. Now the last question. In fact, this overdiagnosis problem is not unique to Fukushima. Starting from Fukushima, many people misunderstand that the thyroid ultrasound examination is good for asymptomatic children, and the damage of overdiagnosis is spreading all over Japan. We have to stop it. What do you think we should do? Neither the government nor academic society are likely to take any countermeasures, and the patients who have been affected are instead asking for more examination. How about advertising on Twitter? Wonderful. Actually, some people are already doing it. If that's the way to go, the government and the academic society have nothing to do with it. That's all the questions. Did you learn a lot? Yes. Then please look at the reaction of the viewers and study further.